And for more now on the FDA's full approval of the Pfizer COVID vaccine, I'm joined now by CDC Director Dr. Rochelle Walensky. Doctor, thank you so much for your time.
Thanks so much for having me.
Some of the nation's governors have recently expressed frustration over the wait for full approval of the vaccine because apparently it's been a recurring reason they were hearing frequently from those who are vaccine hesitant to not get the shot. How confident are you at this point that today's approval will now increase vaccination rates?
You know, the FDA is the gold standard for the safety and effectiveness of these vaccines, and I think that they have done an extraordinary and thorough job in approving this vaccine. I think this is a very powerful signal in the safety and effectiveness. We do know that about 30% of people who have not yet been vaccinated are saying they've been waiting for this approval, and I'm really looking forward to seeing the impact of this approval, especially on those 30%.
Now, for those who did not fully embrace the emergency use authorization process, why should they feel confident this FDA final approval is different?
You know, there have been over 40,000 people that have been studied in these clinical trials. More than 10,000 people have been studied for over 6 months. And we now have experience just in the United States alone of over 200 million people who have received doses of this Pfizer vaccine. We've been studying the safety and effectiveness since December when this was authorized. We have an extraordinary amount of data, and I'm really pleased that the FDA not just took their time and did the due diligence that needed to be done, but did it quickly and efficiently to bring this to the American people as soon as possible.
What are you expecting as far as the timeline for full approval of Moderna's vaccine?
We're waiting. That obviously will be with the FDA, and then Moderna needs to submit their data in order for that to happen. So not getting ahead of the FDA. We do also have a lot of data on the use of the Moderna vaccine, and I'm really looking forward to Moderna following in quick follow.
And today's full approval should also give companies and schools more legal cover in order to mandate the vaccine. Do you hope to see more vaccine mandates implemented across the board to boost vaccination rates?
My preference is always to have people want to get the vaccine themselves and to roll up their sleeves because they know that this is the best thing for them. This will keep them safe and protected from COVID-19. But in the absence of that, I am looking forward to these mandates. We've already seen just today many come through so that people will recognize if they were on the fence and they just needed that extra push that these mandates will get them there.
We've also seen, of course, a troubling rise in pediatric cases in recent weeks, just as children, of course, are beginning to return to school. Pfizer says they plan to submit their data at the end of September for trials on children under the age of 12. What's the timeline? Should we expect to see vaccines authorized for children between the ages of 5 to 12 around November?
That seems like a reasonable timeline to me. Again, we don't want to get ahead of the FDA. Right now, the best way to keep our children under the age of 12 safe is to vaccinate all the people who are around them and to have them wear masks when they attend schools. We know how to keep our children safe from COVID-19. We just have to do all the appropriate things to do so while they're waiting for that vaccine approval.
As a parent yourself, beyond masks in schools, what's your message on how to best keep children safe while the Delta variant is still spreading?
You know, we know how to do this. We know how to vaccinate around the children, surround them by a bubble of vaccinated people. That could be teachers, that could be people in your home, that could be the people and family members that they interact with. Of course, there are many strategies to keep our kids safe in schools when they go to schools. Masking is just one of them, cohorting, ventilation systems, screening and testing protocols, all of these things working together can do so much in order to keep our children safe in school.
The Biden administration also announced booster shots beginning at the end of September for the mRNA vaccines, but the FDA has not yet authorized booster shots, and the CDC Independent Committee has not recommended them yet either. Why sign off then on this plan before the scientists have completed that work?
So this past week, we saw numerous studies that demonstrated that the effectiveness of the vaccines was starting to wane against infection, not yet against severe disease and hospitalizations. We, of course, want to be ahead of that. We will and are planning as an interagency, all-government approach for when the FDA approves those vaccines, those boosters, and when the ACIP signs off on them, that we will be absolutely ready to go. We want to stay ahead of this virus.
On the other end of the spectrum, many people want boosters now as they hear of breakthrough cases and being able to spread the virus. So explain why someone should wait 8 months after their second dose rather than trying to get it even sooner than that.
So we know even with this approval that we have recommendations from the ACIP for those who are severely immunosuppressed to go ahead and get a third shot. You probably didn't get a good response for the first two. But for those who are not severely immunosuppressed, we really do want to see the safety and effectiveness data. We want to go through the proper processes. We see that the vaccine effectiveness is really holding out against severe disease and hospitalization. So please do await the proper process, await the FDA authorization for this, await the advisory committee at the CDC to review the recommendations, and that we are hoping will come the end of September.
There are also some 18 million Americans who received the Johnson & Johnson one-dose vaccine. Do you anticipate them needing to get boosters? What's the timeline for that approval process?
We do anticipate that those who got the Johnson & Johnson vaccine will need boosters. I want to remind folks that we are watching the Johnson & Johnson very carefully. That vaccine was authorized about 2.5 months after the Pfizer vaccine. So the data are a little bit lagging, but only because we started using it a little bit later. We will absolutely be updating our recommendations for J&J as well.
And should they get mRNA boosters or wait for a J&J booster?
We're waiting to see what the data come in from Johnson & Johnson. I anticipate the first recommendations will be about a J&J booster.
One question that I'm curious about, we had an interview today with the CEO of Pfizer, and he suggested that they're already working on a vaccine specific to the Delta variant. Any thoughts on that, or too early to say?
You know, I think we have to wait for the science on that one. What I will say is data have suggested that with the booster and with the second dose, you get an increase in both the breadth and depth of the immune response. And we are anticipating that this third booster dose will likely cover the Delta variant very well.
And lastly, I just want to get a reality check as far as where things stand with COVID in this country. Vaccination rates are up, but just today, the mayor of Honolulu, Hawaii, said that the city will suspend all large gatherings for 4 weeks because of a rise in COVID cases. Do you think that this latest wave has peaked? How long before we start to see cases start to drop dramatically like we did a few months ago?
We have a lot of cases in this country. We're at about 137,000 cases a day. We are now starting to see deaths at over 1,000 deaths per day. The more people that we get vaccinated, the quicker we are to conquer this current wave. We are starting to see in places that we're peaking that they're starting to fall. So that, I think, is good news. What I think it's a reminder for is, for those of you who are not yet vaccinated, please get vaccinated. For everyone in the country, please take all of the prevention measures that we know work against coronavirus, Delta variant, Alpha variant, whatever variant, to protect yourselves, to protect one another.
Thank you so much for your time and insight. Really appreciate it. CDC Director Dr. Rochelle Walensky.
Thanks so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.